Hi, I'm Dr. Ann Kahn. I'm posting this video for World Bipolar Day. It's about psychosis. The video tells the story of the first time I witnessed psychosis, which can be a part of bipolar disorder. Thanks for watching. Enjoy the video. So today I'm going to talk about the first time I ever saw somebody in a psychotic state. So I was very fortunate to train in medicine at Charity Hospital in New Orleans before Hurricane Katrina. So during that time of my training, in the first 2 years, we sat in the classroom and studied. I studied about neurology. I later became a neurologist, studied about psychiatry and psychosis, and then finally got out to see patients. So one day, very early in my training, it was a hot summer day in New Orleans. We get up to 100 degrees. And I was sweating in my white coat walking down the street. And I came to the Claiborne Street overpass and I saw this young guy, maybe in his 20s, and he was wearing a coat. And that was my first clue that something was wrong. He was barefoot, but he was pacing, and his feet were they had some cuts on them, and his calluses seemed so rough on his feet. And he was talking to himself, and he had a frightened look on his face. And I felt upset when I saw the frightened look on his face, and I felt disturbed. I could tell this was an individual in distress, and I suspected he was having a psychotic episode, and that needed immediate attention. So this was difficult, and I didn't have a lot of experience, but I knew we had guards at the doors to the emergency rooms, and I went to the guard and said that I thought this guy in the street needed help. So we got an ambulance, even though he was so close, and they had a lot of really good skills. They had done this before, well trained, and they got him to come in, to the ambulance and get the help he needed at the emergency room. So what help did he need? Well, the psychotic state is toxic to the brain. Psychosis kills brain cells. So just like a cardiologist needs to open a vessel to get the blood to the heart and save heart tissue, people in these acute psychotic states, the brain is literally burning. The entire brain is overactive, and some of the antipsychotic medicines can help slow the brain down so less cells die to lay the ground for the future recovery of the individual. So it is truly an emergency state, and we need to respond to save brain cells for people in psychosis. So perhaps you're curious about the illness. Well, if we think about the major mental illness, I would kind of separate it into two buckets. So, depression can be a deadly illness. Anxiety can be very severe, but people don't usually lose touch with reality. Where in the psychotic illnesses, which are most commonly schizophrenia, schizoaffective disorder, and severe bipolar disorder, people lose touch with what we generally agree upon is reality. They feel and hear and see things that most of us don't see because the brain is not filtering and using the predictive properties in a way that helps one function in society. So those are the two major separations when we think about major mental illness. That was the first time I saw psychosis, but it certainly wasn't the last. So as I continued my training at Big Charity Hospital in New Orleans and I got into my neurology residency, I saw many people with their first psychotic break because we would go as a neurologist and consult and make sure the patient did not have a brain tumor, a seizure making them hallucinate, an infection, an illness like lupus affecting the brain, so that we could, make sure the person received the right treatment for the brain illness that they were enduring. And over time, I saw, psychosis and hallucinations manifest in many different ways. But later, after 20 years passed, my own son had a psychotic break, and he was in the streets of New Orleans. And I called for him, and he was brought to care at the same hospital that I trained at. And there's more of that story for another day.